Colleagues, during my campaign for Senate 3 years ago, Senate Bill 277 was the big topic and became a campaign issue, and I made a lot of new friends in that effort. So thank you, Dr. Pan. So it was for me a baptism into the Senate to watch so many residents from up and down the state lining up on this fourth floor to talk about this particular bill in opposition to forced vaccinations. And this constituency in our state fears infringement on their civil rights and liberties, and they're sensing perhaps even sort of a militaristic form of implementation of some of our laws. So with respect to this constituency, Mr. Chair, I believe a provision should be provided for sanctuary of the sorts. Sacramento did it with cities and the state for immigrants, but we should have a good form to provide medical sanctuary and choice for parents who are concerned about health policies that are dictated by individuals through governmental positions. One might characterize this unique difference of opinion maybe to stubbornness or maybe to arrogance, or maybe it's both. I don't know. But my goal is to provide some form of balance in regards to this healthcare debate. SB 1325 provides the ability of residents to self-quarantine, respecting the right of privacy for California's taxpayers. Basically, it clarifies existing rights. Medical emergencies are extremely rare, but when one occurs, it would be wise to have a protocol in place for those few constituents desiring to address the crisis in a valid and proper manner by providing isolation and preventing abuses of governmental power. Accordingly, I request an aye vote, and I have witnesses in support.
Thank you. We're allowing a total of 6 minutes for the support and the opposition. Please proceed. You can use your time however you wish. Thank you so much. Okay. My name is Greg Glazer. I'm a California lawyer, and I've been a lawyer for 15 years. I am the general counsel for Physicians for Informed Consent. Dr. Kimmel and I submitted a letter with the signature of approximately 60 physicians in support of this bill. This is, according to supporters, a common sense bill. The point is that PANDA, we call this bill PANDA, the Peaceful and Natural Dignity Act. It clarifies rights that we already have, but these rights are important for a very interesting reason. And I really want to engage you here on why this is interesting and why this is important. Currently, there is a problem in California law. The problem is that public health authorities claim the right to be able to forcefully vaccinate peaceful and natural people during an emergency. So that means that in the event of a pandemic, in the event of emergency, you can be a peacefully natural person at home doing nothing. And all of a sudden you can be converted into a criminal. How? For existing? That's the flaw in our current law. So today is an exciting day. Today is a good day. It's an opportunity, and this is why I want to engage you. It's an opportunity for us to fix something, to protect civil rights, to do the right thing, and put a safeguard in place that will protect peaceful and natural individuals in their home. So PANDA is a simple and a straightforward law. There's also a precedent. This is another key point that I'd like to bring to your attention. There's a precedent for this bill, which is that our tuberculosis law, we have a tuberculosis control law, and it says that no patient, even if they have active tuberculosis, can be forced to have treatment, nor can they be forced into a facility. They're allowed to quarantine at home. So this bill allows that same protection, that same constitutional civil rights safeguard to apply also to other infectious diseases. Now, here comes the bonus. This is another thing that I really want to engage you on. This is so interesting. It's that in public health, there is a situation where if you force a medication on someone, if there's an emergency, this is what public health scholars have found. The ACLU's found it, top scholars with the ACLU, top scholars at the CDC have found this. They say, if you force mandates, if you force medication and quarantine on people, it actually increases the spread of disease. This is so interesting because it's counterintuitive. It's counterintuitive because you would think that if you want to prevent disease, well, you mandate medication, right? You mandate vaccines, but it's the opposite. What top scholars have found is that if you do mandates, If you treat people like criminals, guess what? They behave like criminals. They flee the jurisdiction. They lie, they make up stuff. People act like criminals. So what top scholars have found is that if you respect individual rights, this actually promotes public health. And so I am so grateful that there's going to be opposition today, because it proves the very point that I'd like to make, which is that there are actually public health scholars, public health officials who feel that they have the right of absolute power over another person's body. Dr. Kimmel.
Good afternoon. My name is Tina Kimmel. I have a PhD, a Master of Public Health, and a Master of Social Welfare from UC Berkeley. I worked as a research scientist for epidemiologist for the California Department of Public Health here in Sacramento until I retired a few years ago, including in the immunization branch in the Division of Communicable Disease. While there, I volunteered for many emergency training and practice opportunities. So I know the subject of emergency response fairly well. I feel strongly that the new PANDA law, this law, will increase the effectiveness of public health responses during emergencies, while at the same time allowing for families constitutionally protected freedom of conscience. By giving citizens the rights and responsibilities of self-quarantine, they will facilitate public health measures and ease the burden on the public health infrastructure. I want to point out that the bill analysis says that this bill forces people to take self-quarantine. That's not true. In the first few sentences, it says forces, must. It's not. It's may. People may elect self-quarantine. So here's some examples of the ways that this bill would ease the burden on public health infrastructure. This bill voluntarily increases social distancing, which is the goal of all infection control measures, and thus reduces the burden on law enforcement officers, for example, attempting to force disease-exposed people out of public area. This bill increases the number of individuals also seeking remote care from the doctors. It's specified in the law, thus reducing the burden on healthcare offices and personnel. Participants will have alternative effective means of caring for the health of themselves and their families, thus reducing the burden on the local health department's potentially inadequate supply of the new vaccines and other pharmaceuticals that are developed quickly, hopefully under emergency circumstances and usually in short supply. Participants in the PANDA self-quarantine are exempt from mandatory vaccination and medication. They're reducing potential danger to law enforcement officers and clinicians. Self-quarantine locations under this law are more likely to be thoughtfully planned and accountable, thus reducing the burden on infection control officers attempting to enforce the quarantining of goods in place. You've got people participating willingly in that. And they are more likely to be stocked with provisions such as foods, thus reducing the burden on public agencies to provide food. So you're engaging the population to help, to participate, instead of the current law, which forces them and against their will to help in a public health measure. People don't want to get sick. And at the same time, this bill supports individual civil liberties, which are the cornerstone of California and U.S. law, but which will be at grave risk of being trampled on during a public health crisis. This bill is a respectful, calm, and intelligent approach to disease prevention in an emergency. It fixes problems which have been introduced by the current panic and fear-based approach to public health emergencies. Please support SB 1325.
Thank you. We've gone over, it's already 7 minutes. We've only allowing 6 per side. I believe we have one more, so I will allow you oh, you're, okay, all right. So whoever is, will give the opposition the same amount of time. So is there anyone in opposition to the bill? Yes. Or anyone else in support first? Anyone else in support? Okay, so now we're at opposition. And we will give the opposition, in fairness, 7 minutes as well.
Hi, Mr. Chair and members. My name is Kat DeBerg. I am the Executive Director of the Health Officers Association of California, and we're here to oppose this bill. What this bill primarily does is create a new theory of law called self-quarantine, allowing people to ignore health officer orders of isolation and quarantine. Isolation and quarantine are public health tools that exist at the federal, state, and local levels. At the federal level, the US CDC has quarantine authority over people entering the United States and traveling between the states. In California, the authority is vested in the California Department of Public Health, which is headed by the state health officer, a physician who is appointed by the governor and confirmed by this body. And at the local level, that authority is vested in the public health officer, who is a physician appointed by the Board of Supervisors, or in 3 cases, the City Council. In most other states, as in California, violation of a health officer order is a misdemeanor. Survey of local health officers have revealed that formal isolation and quarantine orders are very rarely used. But when they are called upon, it is because they are absolutely necessary. These laws are what kept Ebola from taking root in our country, help us contain outbreaks of infectious diseases such as measles, and minimize the possibility of the spread of tuberculosis. And to address the author's concern, most quarantines already take place in an individual's home. The fact that we are all healthy enough to be here today to discuss this bill is testament to how well our public health laws work in this country. With me today to share her experience of issuing these orders is Dr. Erica Pon, a deputy health officer and the co-chair of the Communicable Disease Committee of the California Conference of Local Health Officers, and she'll take the rest of our time. Thank you.
Mr. Chair and members of the Health Committee, thank you very much for this opportunity to provide my experience. As mentioned, I'm testifying today on behalf of the Health Officers Association of California, and I serve as a deputy health officer overseeing communicable disease control and prevention in California. I'd like to share some specific examples of the times when our authority as public health officials has been deemed necessary to require isolation or quarantine, some of our processes around implementation, and the importance of these roles to protect the public's health. The disease we most frequently use these isolation authorities for is tuberculosis, or TB. Persons with infectious TB need to be cared for in an appropriate healthcare facility with special respiratory isolation to avoid infecting others. Once treatment begins, healthcare providers and public health assess whether a patient is no longer infectious based on very specific tests that can also only be done in a healthcare setting before they can be discharged to an appropriate place to complete the 6 to 12 plus months of treatment. If a person with TB has a stable place to live, that is already where he or she will remain for the rest of their treatment. During the Ebola outbreaks of 2014, in order to respond to a very serious disease that is extremely difficult to treat, aggressive isolation and quarantine measures were crucial to prevent an outbreak here in the United States. Individuals who were potentially exposed to Ebola were frequently allowed to be quarantined not only in their homes, but in isolated areas of camping or other wilderness lands. The crucial component was communication and agreement with those individuals to periodically notify public health of their location, whether any symptoms have developed, and a mutual plan for what to do and where to go if symptoms developed for appropriate diagnosis and treatment. Providing a written notice of self-quarantine to public health officials is not sufficient. Once we've determined someone needs to be quarantined or isolated, we are also monitoring for the development or progression of symptoms. Imagine if a returning traveler from an Ebola country provided written notice of self-quarantine, but then decided to go to various public places, potentially exposing others to a deadly disease. Remember the extreme cleaning environmental measures that had to be taken for public areas such as airplanes, bowling alleys, and elsewhere during the Ebola epidemic of 2014. We also implement isolation and quarantine for measles cases or contacts to prevent additional cases and outbreaks. Of note, we have recently had 6 cases of measles in the San Francisco Bay Area, all in unvaccinated individuals. In my experience overseeing the quarantine of household contacts who are not immune to measles, for this disease that has a 90% attack rate, all of the quarantine contacts have developed measles. But when these contacts are appropriately quarantined, they develop the contagious disease without exposing others. Often our public health successes are unseen by the community, but I can assure you they are important and effective. I unfortunately also saw the negative outcome when we didn't issue a legal quarantine order and a family knowingly allowed other unvaccinated children to be exposed to measles, who then, as expected, developed measles themselves. While people in this country forget about the potentially devastating outcomes of measles, Europe within this past year has experienced outbreaks in almost 15,000 measles cases and 57 deaths since 2016 from measles. When we do issue legal orders, our purpose is to provide clear written instructions on how individuals can safely be isolated or quarantined to help us protect others, which often includes their own loved ones. The orders are issued to ensure people acknowledge that we have conveyed the information needed and agreed to work with us to protect the public's health. Written legal orders also inform people of the consequences of not complying with our instructions, but only if these are violated do we pursue enforcement. In order to enforce, we are required to demonstrate all of the measures we have tried that have failed, and in extreme circumstances, we must get approval from a judge to proceed to enforce or restrict any movement. Our orders are required to and always include information about how to appeal the order. Allowing this bill to move forward would provide a dangerous precedent for our state and prevent public health officials and clinicians from doing our collective job to contain and control infectious diseases. Thank you again for this opportunity to share my experience and testimony.
Thank you. Anyone else in opposition?
Excuse me. My name is Terry Rourke, National Vaccine Information Center. We are in support, but I wasn't able to get to the mic
Thank you.
quickly enough. Thank you.
Mr. Chairman, members, David Jones on behalf of Dr. Michael Johnson, one of the 3 cities with public health departments, Pasadena. Opposition.
Michelle Gibbons with the County Health Executives Association of California, representing local health departments, and here on behalf of the Santa Clara County Boards of Supervisors in opposition to the measure.
Thank you.
Katie Vaughan, representing American Academy of Pediatrics, in opposition.
Farah McDade Tang on behalf of the California State Association of Counties in opposition.
Thank you. Seeing no other opposition, questions, comments from any of the members? Senator Pan?
Thank you, and I appreciate we have an infectious disease expert here. Let me ask, I have a couple of questions for you. So first of all, in the testimony, and the author had mentioned, made reference to SB 277. So one of the implications that in the bill is that when someone is being, let's say, quarantined for, let's say, a disease like measles, they will be forcibly vaccinated. How many times have people been forcibly vaccinated without consent in the state of California in this history?
None that I'm aware of.
Exactly, never. It has never happened. You always have to give consent, or a parent gives consent to a dependent minor if they get vaccinated, even during public health emergencies, even during measles outbreaks.
That's absolutely right.
Yeah. The second thing I also want to ask you is that, and you may not have the answer to this question, but we had measles outbreak in 2015. Can you maybe describe, because you were public health officer in Alameda County, maybe some of the steps that had to be taken by local health officers because of the spread of a disease like measles, the amount of time and money it cost counties and other people, and the restrictions, because we had outbreaks that included people riding on BART, who went to restaurants and stores, went to clinics, and so forth. And what happens when someone decides that they'll self-quarantine but then decide they want to run an errand? Perhaps you can speak to that.
Sure, I'm happy to share a little bit of that information. I think, for example, there are 6 cases right now in the San Francisco Bay Area, and I remember during the 2015 Disneyland outbreak, we had 6 cases in our county alone. For every single one of those cases, we identified over 100 contacts. That is an incredible amount of work for a public health department and our hospital and healthcare provider community to do that contact tracing. Then what we do is we try to identify those who are not able to be immune, the infants less than 12 months of age, the pregnant women, the people who are immunocompromised, who might have cancer treatments or other medications that suppress their immune systems. And we try to provide any prophylaxis for those voluntarily. It's always with consent, but in a way to protect them from getting measles. But again, some of those people cannot be vaccinated and can't choose to be vaccinated. We've never, ever again, just to emphasize Dr. Pan's question, we've never forced anyone to be vaccinated during an emergency, but we do require that they be quarantined so that they don't expose other people. There I do have some calculations not at my fingertips, but I'm happy to provide them to this committee if needed about the costs to both public health departments and healthcare facilities and providers of measles, even for individual cases. But there were definitely hundreds of thousands of dollars spent. Emergency operations centers were activated. Huge numbers of staff were deployed to deal with measles during the Disneyland outbreak. And even during this recent outbreak in the Bay Area right now, there are a lot of staff working very diligently to try to contain this particular outbreak. They're all currently linked, but again, we have concern about public exposures. And the other interesting thing about measles and other infectious diseases, often people are infectious before they're actually symptomatic. So we are, even if somebody doesn't know that they have an infection like measles, they're actually infectious for 4 days before they have a rash. So we spent a lot of time trying to figure out where those people were and who they exposed for those 4 days when they might have thought they just had a cold, much less if they actually actively know they have a disease and are infecting or exposing other people. And measles, again, as I just wanted to emphasize, is a 90% attack rate if people are not immune.
Thank you. Yes, Senator Newman.
So, Senator Moore, I have a question, and it has zero to do with epidemiology. So, there is a tradition, as it were, in Congress of naming bills with acronyms. I don't see that much here. Where did the acronym PANDA come from?
That was from the sponsors, so I don't really have the history of it.
So, the panda animal would seem to have very little to do with vaccinations, but it does tend to have an ethnic or racial tinge to it. It also includes the first 3 letters of my colleague's name, and I could see where one might take offense. Thank you.
Can I respond to that?
Yes, please respond.
Lisa, let me just to that, Senator Newman. I will be honest with you, that has never crossed my mind. I've never seen that this was done in that fashion. So I'm kind of shocked to hear it, so forgive me. That was not the intention.
I hope you're not shocked that the reasoning was applied, but I'll take you at your word. Thank you.
Thank you. So seeing no other questions, comments from any of the members, Senator Morlock.
Thank you, Mr. Chair.
I'd like to close.
Just a few comments. Appreciate the fact that the health officers are opposed. Certainly have a great relationship with Eric Handler from Orange County. And so we've had a good chat on this. And I think his predecessor even came up and served as the state health officer. So had a good rapport in that regard. If someone violates a self-quarantine, that's a whole different animal. That's making a mockery of this opportunity to self-quarantine. And I believe that should imply that person or those persons should have some kind of fine or penalty to pay for those costs. But this is an ability to provide some balance. It's an approach to work with all of the public to have an adequate protocol to protect all the residents. And I just want to affirm their ability to pursue their civil liberties. And you've kind of caught me off guard. And so if anything was meant to be personal, I apologize for that. And I respectfully ask for an aye vote.
I believe Senator Pan may want to respond.
Senator Morlock, I appreciate our work together, and I know I spoke briefly with you about some concerns about the bill, and while I have to admit I'm not going to be voting for this bill today and may not leave the committee, if it does, I hope you seriously consider changing the title of the bill. Thank you.
Duly noted.
So
If I could
No,
just
you
say,
can't.
for the record.
No, you were not asked a question. Is there a motion?
I'll move.
We have a motion by Senator Nguyen. I believe you closed. Is that correct, Senator? Chair will not be voting for the bill. This is item number 13, SB 1325, due pass to judiciary. Call the members, please.
Hernandez.
No.
Hernandez, no. Nguyen. Nguyen, no. Leyva. Leyva, no. Mitchell. No. Monning.
No.
Monning, no. Newman.
No.
Newman, no. Nielsen. Pan.
No.
Pan, no. Roth. Roth, no.
currently at 0 to 8. That bill fails.